Oh, hello. Welcome to the walk-in ear clinic. Wasn't really expecting anyone to come in. I'm a brand new doctor and I kind of made my mentor mad, so they sent me to do all the work here myself. So that means I'm going to be the one doing your intake paperwork as well as all of the, doctor-y things. Yeah, please sit down right there. Thank you. All right. So first, what's your name? And your date of birth? And oh, really? Oh, and then there's billing. Billing. I have discretion as, the doctor here to give patients free care. I have a feeling the hospital will get mad if I give it to everyone, but, you're our very first patient, believe it or not. So I kind of think of it, I'm going to give it to you, and we'll think of it like a welcome to the neighborhood gift. Although I guess that doesn't make any sense since I'm the one who's new to the neighborhood. Oh, that reminds me. I just moved into my new apartment upstairs in this building, actually. It's not very big, but it's where I have to live while I'm running this place all by myself. It's a kind of a cozy little living situation, actually. But I don't know anyone around here or where anything is. Would you mind recommending me some places? Like grocery store, laundromat. Oh, I'm sorry. We're supposed to be filling out your intake paperwork. Sorry, I get, so distracted, especially when I'm talking with someone. Oh, anyway, don't worry about insurance or anything like that. Just one last question. What's your occupation? Um, all right. It's interesting. I don't have any experience with that myself. Um, Do you work around a lot of loud noises at that job? Chronic exposure to loud noises can damage your hearing in the long term, even if they're not super loud. Individually, over time, it wears down on your hearing. All right. All right. I see. And what symptoms are you experiencing today? All right. Fullness in the ears. Difficulty hearing people talking far away. Well, I'll just have to lean in close then, I guess, won't I? Oh, sorry. Thank you. That's all the paperwork done that we need to worry about for now. All right. So they haven't gotten the running water working in here yet. I actually had to go to the gym on the corner to shower this morning, and we have to use the bathroom in the game shop next door to us. The lady who owns it's real nice and doesn't seem to mind, but I don't know. I kind of want to avoid going in there more than I need to. She was kind of saying some weird things to me when I was introducing myself. Just makes me a little uncomfortable, but anyway, that's beside the point. I can't wash my hands, is the point, before doing your exam, and that's kind of necessary. So I'm going to need to use some hand sanitizer instead. This is probably really illegal to be doing this instead of properly washing my hands. So just don't tell anybody, all right? This will be our little secret. Oh, and would you like to try some yourself? It's actually my personal favorite. I brought it from my home, I suppose, which I guess is just upstairs. But it smells like mandarin orange and rosemary. I gotta lather it up real good to, get all of those germs off. You doctors are taught to wash their hands even more, to an even more extent than everybody was being told with all the stuff that was happening a couple years ago. And even when it's hand sanitizer, you just get in a habit. All right, that should be good enough. Got all the germs off. And then next, I've got to get some gloves on. I really hate these ones. They're cheap, they tear, They always cling to the skin when you're trying to get them on. That's the first one. Oh. Maybe if I do a better job than I did at my last attempt, maybe they'll give me a better budget and I can get some better gloves than these ones. Or I guess I could just switch to regular old hand sanitizer instead of the good stuff. No, that's completely impossible. I'll just stick with the gloves that I have, I guess. Okay. Alright. Now this is my otoscope. That's Latin for the thing that lets you look inside someone's ears. But actually not looking in your ear to start with. First, I need you to open your mouth and stick out your tongue like this. Bleh. Oh, yeah, I know that you're here for your ears and not your throat. Actually, I'm an otolaryngologist, or ear, nose, and throat doctor. When you get fluid or mucus buildup in your ears or sinuses, all that sticky fluid ends up draining down the back of your throat, which... Why are you giggling? Well, it often ends up giving you a sore throat as the infection spreads. So I'm going to use this otoscope and I'm going to look down your throat. This otoscope's a cool one. It can switch optical zooms when I press the button. So I can look really close at all of those cells, which are hopefully not too inflamed. Now, just a warning, the light on the otoscope's really bright, so it's going to feel pretty warm when I shine it on you. Just try to relax, and I personally find it to be a pretty enjoyable sensation. So stick out your tongue like this. Bleh. And here goes. Yeah. Hmm. Okay. You can close your mouth. Oh, no need to apologize. Your breath didn't smell bad at all. Kind of minty, actually. Good job brushing your teeth well. Alright, so your throat looked perfectly healthy. No sign of an infection spreading from your ears to your throat, which means we can rule out otitis media, which is also known as a middle ear infection. Now I'm finally going to look in your ears. Did you know that we have 25,000 nerve endings in the ear canal? It's way more sensitive than your throat, so I'll try to be gentle. Alright, I'm going to take some more pictures with my otoscope. Yes, that's quite a lot of cerumen buildup. That just means earwax. Let me guess, you use earbuds a lot and probably even clean your own ears with Q-tips? Oh, your ears are turning red. That's so cute. I mean, no need to be embarrassed about the Q-tip thing. I'm gonna look at your right ear now. I know that wherever you look, people will tell you to never use Q-tips because they push the wax down. But you know, everybody does it. Even doctors like me. I know it feels so good you just can't stop. But that's why people like me are here, to clear things out every once in a while. Alright. Just sit back and relax now. Just close your eyes, take a few deep breaths, and we'll do this slowly, I promise. First, I'm going to use this Q-tip. Oh, maybe it'll seem a little more professional if I call it a cotton swab, huh? So I'm gonna take this cotton swab, coat it in some sanitizing lotion, and rub it around your outer ear to minimize the risk of infection as we clean further. Alright? Just get a little bit on the end there. Just gotta get that coated. And then alright, that's good for the left ear. Now for the right. Every little nook and cranny. Alright. Now, this little thing here. This is a little nylon tool called a Jobson horn. It's got a pick on one end, and it's got a loop on the other. And I am going to use it to scrape out all of that earwax that's sitting in there. Just to let me know if it hurts, and I'll pull out immediately. You know, we had to practice on each other quite a lot when we were medical students, and I've always been told I'm gentle and I make people feel good when we're doing it, so no need to worry. Alright, left ear first. Sure am glad that we did the lotion first. That'll minimize unnecessary abrasions, friction with the ear canal. Sorry if my breath is tickling you. I have to get, very, very up close there to get this done. I'm gonna switch to the other side. Other side of the tool to get all the last bits out. Wow, look how much came out. Oh, no need to be embarrassed. It's very normal. I guess it's just been a long time since you've had this done properly, huh? Oh, you've never had a doctor do this before? Okay. Right ear time. Well, I'll have you know that I am honored that you put so much trust in me to stick this thing in your ear. Yes, I know that I'm a professional, so of course you should trust me, but, I look so young. People don't really take me seriously as a doctor, especially my mentor, hence why I'm, getting into trouble for absolutely no reason at all and getting sent here to... Well, I guess I'm happy that I was able to help you today. I'm gonna use the other side of this. Yeah, I suppose it's not the end of the world if I'm still able to help people here. Can't say this is what I envisioned I'd be doing as a doctor, but there's many worse things I could be doing. I'm glad you came in today. Makes me feel better about this whole thing. Okay, wow, that's everything. I can't believe how much more came out of the right ear. Look how, well, I'm sorry, I'm not trying to tease you, I promise, though you make it so easy. Well, that's not a very professional thing to say, especially to my very first patient. And I promise this isn't the sort of reason I got sent here. But, wow, you must be able to hear colors now. Right, just let me get my keyboard again, because we need to add a few more notes to your file for release paperwork. Cerumen extracted. Both ears. No sign of otitis media. And, well, essentially no red flags. you're all set. Don't forget to grab your coat. It's so chilly out there lately. Although, if I had to be sent all the way up here, I'm glad it happened in autumn. The colors are just so beautiful here this time of year. I can't wait to start meeting people around here and going on leaf viewing walks and things like that. Oh, my phone number? Well, if you just Google the clinic, our phone numbers, I'm sure, just going to be listed there. Or we have business cards you can take. You want my personal phone number? Uh, uh, I wasn't expecting that. Even though I was so unprofessional today, you still want to talk to me again? Yeah, sure. Yeah, here. And there you go. Well, it was very nice to meet you. Talk to you soon.